Ronald Nyakweba. I'm the CEC for Medical Services, Public and Sanitation, Kisii County Government. Today we are gathered here for three reasons. This is the World AIDS Day, basically to address three key issues. One of the issues is to remember the journey that we have walked insofar as the war against HIV is concerned. It has not been an easy walk because when this work began, the preference rate on HIV and AIDS was at 8.9%. But because of the concerted effort from government and partners, this pandemic has been reduced. The preference has been reduced from 8.9% to 3.8%. But that is in Kisii. Nationally, statistics are very clear. HIV/AIDS preference stands at 3.3%. But in Kisii County, we stand at 3.8%. Those are the facts. That is data that is available for all of us to see. Preference rate on the youth, those ones who have been tested and have been put on care, the numbers stand at 2,410. Yeah? But those ones who have been virally suppressed, those ones who cannot now transmit from one person to the other, the statistics are very good. We stand at 98.98%. Yeah, those ones on ART are at 95%. Actually, 95+%. ART means those ones who have been put on ARVs, who are currently been tested, found living with HIV and AIDS. Now they have been put on what? ARVs. They are taking ARVs. So those are very good statistics. But what are we supposed to do? We are supposed to continuously engage, create awareness, tell our people to go for testing, so that once they are discovered, testing, as we have heard, must be a continuous process. So that when you are discovered to have having this particular disease, you are put on ARVs. It can be viral, it can be suppressed if it is discovered on time. So we are urging our people, they need to come out. AIDS is not a disease, it's a condition. You have heard our young boys and girls saying there, it's just like any other condition. You can have a cold. Are you going to be declared dead? No, it's not a death sentence. It's a condition that can be managed, that can be suppressed if it is discovered on time. So that is in essence where we stand in terms of statistics. I will tell you, as Kisii County Government, a lot has been done. We have a very dedicated team which is actually out to fight this pandemic. We have an entire directorate with program officers in charge of HIV and AIDS. We have done very well so far, so good as a county government. So now pungia mkono wafanyikazi wa health. I want to thank His Excellency the Governor of Kisii County for being very supportive, because without his support we would not be where we are here today. He is always very keen on wanting to know where HIV/AIDS prevalence stands, where Kisii stands in terms of HIV/AIDS and prevalence, and those statistics are in his fingertips. The U.S. government for the last 5 years, it has been scaling down the support that we have been receiving from PEPFAR. PEPFAR is a presidential presidential emergency fund for AIDS relief in Africa. So they have been scaling down their support for the last 5 years. The last 3 months, they have reduced the numbers of employees that they were supporting in the Kisii County from 610 to about 220. But recently, as you heard, for us to address these gaps that are going to exist as a result of that withdrawal, the Kisii County government has moved fast. We have advertised positions for employment of over 300 health workers, purposely to mitigate the withdrawal of the support that we have been receiving from the US government. So we are not going to suffer any crisis, because currently as we speak, the Kisii County Public Service Board is doing the shortlisting so that we can employ over 300 elder workers to occupy the gaps that are going to be left as a result of the withdrawal of the support we have been receiving from the US government. We recently employed over 110 health workers, and we are going to employ 310 more, so which will bring the figure to around 420, which the US government has stopped funding. So we already addressed those gaps. So we are far ahead in terms of ensuring that the war is not dropped against this pandemic. A lot of awareness. We are currently identifying those young boys and girls, because the preference rate is very high among the the youth and the adolescents. So we are currently engaging them. Actually, we have the KYP, AYP, that a team that is handling those particular young boys and girls who have that preference. Remember, we have set up HIV testing and counseling centers across our county, where people can go, be tested freely, and then when you are discovered, you are counseled and you are put on ARV. So that's one of the mitigation measures they have put into place, opening VCT centers where people can go, voluntary counseling and testing centers where people can go and do what? Get tested to know their status.
So my name is Sanya Henry. I work with the Kenya Red Cross Society as a county coordinator for Kisii and Nyamira. And today we are here with my team, as you may see. And even right behind me, there's an extra tent that we have. We have first aiders there on standby. We have peer educators there who are taking our young people through and the understanding of what HIV is in detail, what is happening, the new trends that or new trends of infection, and what are the modes that we may have to use to get to prevent ourselves from new infections. So today is the World AIDS Day, and it's a global commemoration of the HIV and AIDS since the time when it came into us, living with us as a people. And we are not using it just as a commemoration. We are using it as a platform to try and tell our people that yes, HIV is real. It is here to stay. It's not going anywhere. But the most important thing is that how do we then prevent new cases of infection amongst adolescents and youth, because that's the theme of the year. An area that has really been a blow to the Kenyan government, not just the humanitarian aid workers and the public, but the entire government as well. Because then one is that it has caused a reduction in number of staff. You may realize that most organizations that are dependent on USAID have had to cut on the staffing, and that really reduces on the population that you are able to reach. Because the more staffing, that means the bigger the population you'll be able to reach. For example, for programs that are running with the project officers. So if the project is withdrawn, then it means you may not be able to reach as many people as you are reaching initially, and you will depend on the facilities, those who are coming to the facility. So outreach programs have also been reduced, and over and above, it means that we may need to start looking for other avenues of reaching out to our people other than depending on USAID. And that is true for those who are on nutritional programs. Again, there is a scale down on the same, which is really a big blow, and therefore we're still hoping that things may change in the future. But as of now, we are really affected, and not just us.